Hello, my name is Christian Edwards, and this week we are going to be discussing the making of governmental policy. So, a bit of an introduction. First, we're going to go over the historical background of um, the governmental's role in the creation of policies regarding social issues, because it hasn't always been consistent. And then we'll discuss each stage individually. And because this is not like a poverty presentation or discrimination or the voluntary sector, I ended up choosing a current policy, and we will walk through the legislative history for that specific policy. And then we will discuss the NASW stance. We'll go over the conclusion, a couple discussion questions, and then my references. So a bit of some historical background. Our founders, while the government has always played some part in social issues, our founders believed that less government is better, less is more. This is due to what happened over in Europe. They didn't want that to happen again here. And so they felt as if the government only needed to handle issues pertaining to like exporting of goods, while the state handled issues regarding healthcare, regarding poverty, those types of things. In 1854, President Franklin Pierce, he denied federal land being used for building psych hospitals. He didn't want to be seen as a country that just provided a ton of money to the poor. When the Great Depression hit in 1929, there was no support from the government. But because of that, it did lead to the implementation of the New Deal, which basically stated that the federal government has obligations to its people. And so that kind of kicked things off in the government being willing to play more uh, of a role in addressing social issues that everybody is experiencing and going through. And then in the 1960s, there was a shift. And so in the 1960s and the 1970s, there were more creation of policies than there had ever been before. And some of those policies are the Rights Act, the Voting Rights Act, Medicaid, Medicare, the Head Start program for children who come from low income families. And so we were on this really good high of policymaking. And then in the 1980s, President Bush decided to pull the government back. And so that policymaking process did slow down, and there was no change in the 1990s. President Clinton created the Personal Responsibility and Work Opportunity Reconciliation Act, which limited public assistance. And so then, now that we're in the 21st century, again, there has been really little to no improvement. It honestly kind of just depends on who is in office at the time, on how much government plays a role in social issues. So President Bush continued on with the little role for the government, but then when President Obama came, he did try to balance things out and show that the government is still needed. Um, and the NASW stated that public policy is the dominant variable in determining the nature of social work practice, and it is profoundly affected by governmental policy. So, with that, we will now transition into how the creation of a governmental policy plays out. So, there is a process to this. It starts with the formulation stage, which is where the problem is brought to everyone's attention, and then it will then move to the legislation stage where solutions are created for that specific problem. And then there's the implementation where the rules and regulations are set. And then after that, after some time, it will be in the evaluation stage where any revisions are made, or if it needs to be amended, that's where that would take place. The first stage, formulation. The key players are legislator staffs and policy institutes. So, because legislators are very busy people, they will hire other people to take on current social issues and like be the ones who listen in this initial stage. And if they feel the need that it's something that needs to be taken to the legislators, then they're the ones who will initiate that. Um, but before the 19th century, people could actually go straight to the legislators. But since times have changed and the world is also changing, they had to make some adjustments. Um, and so those who are working for the legislators, they are the ones who can address within these initial steps. Some examples of this is the University of Wisconsin's Institute for Research on Poverty. They are hired and created to provide analysis on critical welfare policies. And then another example is the University or Harvard University's Kennedy School of Government, and they promote innovation in social policy. So our next stage is the legislation stage. There are a number of key players in this one. We have the Senate, we have the House of Representatives, we have lobbyists, we have PACs, are also referred to as the political action committees, and then we also have advocacy groups. And so within the legislation stage, this is where the people who brought forth the attention to the social issues in the formulation stage, they are then able to attend legislative hearings and present their information to all of these committees in hopes of being able to get the policy approved. And so the committees that we have within this legislative stage for the Senate, there's a finance committee, there's a health committee, there's an education committee. For the House of Representatives, another committee for them is Ways and Means. Our lobbyists, they're the ones who oversee political campaigns, influencers, and sponsors. Their top group is Aiken Gump. For our political action committees, who they're in control of all campaign funds. Their top group is the National Association of Realtors. Advocacies, they do help with specific issues, but there's no funding. And so in this stage, this is where there are policy approvals. Um, and this is an area that Republicans have experienced great success just due to the organization of everything. So for our third stage, this is the implementation stage. Our key players, the public, and assigned agencies. And so in this stage, after a policy is approved, just because it's enacted does not mean it's going to get implemented. So there's a lot of um, pros and cons in this stage for the simple fact that a policy's failure to be implemented could be due to a number of factors. And unfortunately, social welfare programs are victim to this, and it ends up causing a lot of out of compliance. Um, and in this stage, this is also where rules and regulations are created. And so there is this thing called the congressional record that is sent out, and the public is actually allowed to provide input on the rules that are set for this policy. Another reason why implementation is failed could be because the government also shuts down. So there was a government shutdown a couple years ago, and that 100% slows the process down by a ton. So our last stage is the evaluation stage, and this is essentially where our key players, governmental units, universities, private consulting firms, they review the programs that have been implemented, and they basically ensure that they are staying within compliance. Um, this was created due to the aftermath of Watergate and the Vietnam War, and essentially what they realized is that executive branch use and abuse their power. And so they hired other agencies to essentially just offer another level of checks and balances. And so the program assessment rating tool was created, and in doing so, it was able to find that 1/3 of the programs that were being implemented were not effective, like they were not staying within compliance. And so, because of this, there was a decrease of the ineffectiveness from 55% to 25% between the years of 2002 and 2006. In 2018, there was the implementation of the Evidence Based Policy Making Act, and this act opened the door to an improvement on future programs, as it made the requirement that whatever was being implemented had to have solid foundational research to prove its worth, basically. So some of these universities, private consulting firms, some of them, they're the Washington Institute for Public Policy. We have the Pew MacArthur Results First Initiative. And then there was also the creation of the state and local innovations that was basically initiated by MIT's Poverty Action Lab. So the policy that I chose to walk through these stages with was the Child Abuse and Prevention Treatment Act. And as you can see in the formulation stage, between the ages of 1964 and 1973, all attempts failed at getting a child protection law implemented. And it wasn't until, at the time, Senator Walter Mondale, who later became the vice president, introduced it on March 13th of 1973. And then by July 10th of 1973, it was amended by the Senate and then amended by the House of Representatives on November 30th of 1973. It was then made a law by President Nixon on January 31st of 1974, and it was the first policy to define child abuse and neglect. It did open the door to improved detection and reporting of child abuse, but as time went on, there were certain inconsistencies that were brought to life, which is where the evaluation stage comes in, because that's where all of the revisions took place. And it's been revised a number of times, with a more recent one being in 2010 when it was amended and reauthorized. So the NASW does 100% believe that every level of government has a role to play in making policies that address current social issues, whether that's the local level, the state level, the federal level. Um, it wants to see continued, um, you know, workings of having access to legal services, increased access to mental health, increased access to substance abuse or universal health care, education. And social workers need to be able to have the ability to work with the government on making sure that all of those issues are still being addressed within a timely and effective manner. Um, and in order to do that, the NASW is willing to maintain the outlook that the government is an embodiment of the people by the people, rather than just seeing it as two separate entities. And so the NASW believes that everybody needs to work together. There needs to be unity and consistency across every single board, in order to ensure that the necessary policies are being made. So in conclusion, it's a marathon, not a sprint. Creating a policy, it could take, a couple months, it could take a couple years. And just because it gets enacted doesn't necessarily mean that it's going to be implemented. Um, and also another downside is that the process may remain the same, but whoever is currently involved is always evolving. And so that can also definitely affect what policies get passed and which ones don't. And then the only way for true change is through unity and not division. So current discussion questions are: after reviewing the provided article regarding the legislative history and timeframe of the CAPTA, using your understanding of the process on creating a governmental policy and its history, what would be an appropriate explanation as to why the implementation of a child protective law failed during a time in which more policies were being passed than ever? The second question is, as a social worker, in what ways do you feel as if the policymaking process should be adjusted to better promote inclusivity and ensuring all voices are heard, regardless of race, ethnicity, socioeconomic status? And is the current process reasonable when it comes to making social welfare changes? Or do you feel as if the process has set social advocates up for automatic failure? Please explain your reasoning. And these are my references. Thank you.